So for example, we were doing stuff with Afghan religious leaders, and so the question was, well, when a girl is an adult, then she can marry, and that's been based on menstruation. Well, okay, menstruation is one aspect of physical development, but pelvic growth is another. Should we also be considering that? Because it never actually specifies menstruation in the Quran. So these are the dialogues we could be having that can be more respectful and engaging of people. So what can we do? Well, I certainly think that there are policies and programs that exist, but we need to reinforce them, and we need to really be looking at them in a way that considers better the issues of gender equity and autonomy. We need to be doing more with men, and we have a couple of projects, one that's funded now, which is a gender equity program where we're counseling men and then turning to the wives of young rural men in India, and then we turn to their wives. We also just submitted a grant called Chance, which right now there's the program in India is that you go when you find out, so the community health worker finds out who's pregnant and goes to the house to visit the woman to talk about good nutrition and the importance of delivery in a healthcare institution. But we're revising it to say now go and do it with a family instead of just the wife. So the first 3 sessions are with the family, and the last 3 sessions are just with the wife, so you have the opportunity for her to have voice. Also, I think social and structural interventions to improve social support, economic stability, and mobility of women and girls is important. We have a grant right now that is an HIV intervention that is household-based, that is reaching out to women in their homes who are struggling with issues of husbands being abusive or engaging in risky alcohol use, which are major concerns generally for the household, but they're also major indicators of HIV. So we are having these conversations about sexual autonomy and social support and communication, and they are not easy conversations to have for women who don't have full control of their situation. But when we talk to women, they actually, this was something that came from women that we were working with. So it really shows that it's not that I'm saying that individual level intervention isn't useful. It is. It's just by itself it can't have impact. And we have a program, it was not funded, but a program to reduce girl-child marriage. And cute aspects of this program. I did not come up with this, but for example, how do you make sure girls marry after age 18 if they don't know their age? So part of the program is to have birthday parties. And help establish age, and so that they have an awareness of it. So these are some of the things we're doing, and it's some of the things that I hope can generate ideas for people to do more, because obviously, you know, any individual can make a dent in it, and hopefully that dent can get bigger if the more of us are doing it. So I just want to thank a few people for this. So first, I have a program manager that, God bless her, because I had a grant due last week, so she was very helpful pulling slides with me this week. I want to thank my collaborators, Dr. Jay Silverman, Dr. Niranjan Sagurthy, Dr. Danta Balaya, Dr. Saritha Nair, Anita Raj, Dr. Madhu Batalia, and our research teams on CHARM and our MCH study and the Rani Wives study, because, oh my God, you know, I live here. I'm not doing this work. Ultimately, I'm not doing this work. I'm collaborating to come up with ideas, and I'm helping get funding, but these are the people that make work happen. I want to thank Carol Jordan and everybody with the Center for Research on Violence Against Women, but I also want to thank you for coming, because not only do I want you to come, but I want you to go out there and do something, because, you know, I don't want to do it by myself, please. And there's so much to be done, so thank you. That's it.